Thank you for watching this video training from www.intouchemr.com, the fast, integrated, and easy EMR. Visit our website for a demo and a free executive briefing on the 5 blunders to avoid with EMR.
Hey everybody, this is Nitin Choda with InTouchEMR.com, and in this video I'm going to talk to you about the importance of flexibility in your documentation process. There's a big problem out there with most EMR companies, with most EMR software providers, and that problem is forcing the clinician to use documentation templates. Now, while this may seem like a good thing, a cool thing, even something that makes your life easier, I would strongly recommend that each clinic, each physical therapy private practice be able to A, create their own templates, and B, use your own custom templates when documenting for several reasons. For starters, most templates that are provided by EMR companies are extremely detailed, and that's a good thing because you want to be efficient, you want to be comprehensive with your documentation. But here's the problem. The physical therapist is the most important person in the clinic because the documentation done by that therapist and the treatment done by that therapist is what drives the money in the practice. It's what drives the revenue. It's what drives the claims, the billing, and that in turn allows you, the physical therapist, to pay other staff members and obviously to make a profit. If a template in your EMR system is extremely detailed, it forces you to become a data entry expert. Again, it forces you to become a data entry expert as opposed to a clinician that documents your way. In my opinion, documentation, your EMR system, this is what we do at InTouchEMR.com, should give you the flexibility to create your own templates from scratch. It's helpful if the EMR system gives you some templates like we do, but fundamentally you should create your own templates from scratch. And I know it's a little time consuming to do that initially. I mean, if you fax us your templates, we'll even create the templates for you. So that's a big feature. Again, if you fax us your templates, we'll even create them for you, but you need to have complete flexibility in your documentation process, and here's why. First of all, when you get audited, you need to be able to prove that you're using a very precise style of documentation, which, if it's customized to you and if it's specific to your patients, is better for you because you're documenting your way as opposed to just using ready-to-go templates. You don't want to use ready-to-go templates because it's going to make life harder for you if you ever get audited. That's number one. Number two, every practice is different. You want to be able to create your own type of documentation template. And number three, most importantly, your documentation with your own templates, and you can only do that if you have flexibility in creating your own documents and your own templates. Your own documentation should always be compliant, comprehensive, yet minimal. You want to do enough to support what you're doing and why you're billing, but you don't want to do so much, and you don't want to do an overkill where you're documenting so much that you're spending hours and hours and hours doing documentation. I don't want that to happen to you, and that's what happens if you use these templates provided by systems that tell you that you're getting templates, but in reality, they're making you data entry machines. You want a system like InTouchEMR.com that allows you to have a completely integrated workflow from scheduling to documentation to billing, completely integrated. That's much more important than creating the best documentation system in the world or creating the best templates or creating the most compliant documents which will never ever be seen, because documentation is something that essentially stays with you and is proof that you've done what you want to do. So you want it to be minimal yet comprehensive. I'm not talking about not being comprehensive. I'm talking about simple, effective templates that you can create on your own and customize. That's exactly what we do at InTouchEMR.com. Go on over to our website to schedule a demo. Even if you don't do any business with us, that's fine. We'll send you a free report on the 5 blunders to avoid with physical therapy EMR, and I think that report alone will save you a lot of time and trouble in your practice. Thank you so much for watching, and I hope you understand the importance of flexibility and customization in your documentation process, and you keep your documentation templates and all your documentation simple, minimal, yet detailed enough to support what you're doing. Thank you so much for watching. And as a physical therapist, I know how difficult life can get. My goal is to make your life easier. Go on over to intouchemr.com and I'll be happy to show you what we can do for you. Thanks.
Thank you for watching this video training from www.intouchemr.com, the fast, integrated, and easy EMR. Visit our website for a demo and a free executive briefing on the 5 blunders to avoid with EMR.